All right, well, we got one more guest question from the Herb Rally audience, and this is from Amelia. And Amelia asks, I have a question for KP. I hear a lot of talk about perimenopausal women needing to balance their hormones. I prefer to work mainly with food as medicine, but I'm never sure how to tell which vitamins a woman is deficient in based on her symptoms, amenorrhea, mood swings, waistline, weight gain, etc. How does a woman know which hormones need to be balanced? How can you tell whether you're estrogen dominant, estrogen deficient, progesterone dominant, etc., and figure out whether things like Vitex, Evening Primrose, or DIM can help you in your situation?
Uh, yeah, it's very tricky. The really the way to do it is just by blood tests. I think that the questioner is implying that she doesn't want to use blood tests, but that's a way to go. Well, let's talk a little bit about liver congestion here, which is the cause of a whole lot of this. There are some herbs that are general hormone regulators. The idea that we can specify which hormone any given herb affects is, I think, we're not at that point yet. And so we see, for example, um, chasteberry, an herb that many people say is progesteronic, that is, enhances progesterone. The evidence for that is pretty spotty. So you have to get into some pretty serious education to figure all this out. But the liver plays a big role here, and most of the time, uh, women with hormonal imbalances, the trouble that they're having is with their liver. So the liver is congested. That is, not enough blood is able to pass through the liver fast enough to do what the liver needs to do. It's backed up in the circulation, congested liver. Um, we have to treat that, and we use liver cleansers. So the liver is responsible for number one, making cholesterol. All those hormones that were mentioned are made from cholesterol. So the liver makes cholesterol, and then that it spits it out into the small intestine, and then it's reabsorbed into the blood, and then goes to the gonads that make these hormones. And then those hormones travel around the body and do what they need to do. But then it's the liver that tears them down again. That's where the problem starts. And so the brain is trying to tell the liver and the gonads what to do to keep these things in balance, but they're having difficulty doing it because the liver can't tear it down. So the gonads are making estriol, progesterone, et cetera, at their regular rate, and those are building up, and then the liver is not tearing them down. So we use liver cleansers. The number one remedy for that in Chinese medicine is the herb bupleurum. That's Buplurum, bupleurum. Uh, Bupleurum is a liver harmonizer, and harmonizing that action, treating the liver, is used in 80% of Chinese cases. It's just so overwhelmingly common that we can give just about anybody liver harmonizers or liver cleansers and expect to get some really nice results. That herb is very easily available out there in the herb marketplace. It's less likely to cause nausea than some of those other liver herbs we talked about. I did mention Pumi amalaki earlier. That's an herb that could be used for the same purpose. But any generic liver cleanser like dandelion root or whatever, there's dozens of them, is likely to work very well for that issue. So rather than trying to figure out which hormone is dominating and what you do about that, that's a very brute force approach, and it's difficult to make that work. Usually, liver harmonizing works better. So the bupleurum, you can take that in capsules, and typical dose there is about 8 grams. Again, with the proviso that if you take too much, it might be nauseating. So you work your way into it.
So you continue to see clients. Do you and your practice use blood tests to inform
Yeah,
your
very much
practice?
so.
Okay.
Yep.
Do you recommend it to other clinical herbalists as well?
Of course. Yeah, learning about blood tests can be very valuable. In most states, people can order their own blood tests at a private pay lab. Not every state, but most. And you can go there and have them do whatever tests you want. So if your medical doctor is unwilling to order the test, you can just go do that. So basic hormone panels are inexpensive, easily available, and they measure all those hormones that were mentioned by the questioner.